green thing in the middle of the bigger blue thing on a map is an island. I was hoping for something a bit more creative.
Shouldn't we be speaking to the patient before we start diagnosing?
Dr. House doesn't like dealing with patients.
Isn't treating patients why we became doctors?
Oh, treating illnesses is why we became doctors. Treating patients is what makes most doctors miserable.
All right, Rebecca. I know you may feel a little claustrophobic in there, but we need you to remain still.
Okay, we're going to begin.
I don't feel so good. Rebecca. Oh, she's ashen.
She's not breathing. Epic 0.5.
Come on. I can't ventilate.
Too much edema. Where's the surgical airway kit?
Yep, coming. We'll get that tube out of your throat later today.
Just get some rest for now. I knew she was allergic to penicillin and figured it was an easy way to get someone to cut a hole in her throat.
Can't get a picture. You have to get 1,000 words.
You actually want me to talk to the patient? Get a history?
We need to know if there's some genetic or environmental causes triggering an inflammatory response.
You couldn't have knocked.
Steroids. Give her steroids. High doses of prednisone.
You're looking for support for a diagnosis of cerebral vasculitis.
Inflammation of blood vessels in the brain is awfully rare, especially for someone her age.
So is a tumor. Her SED rate is elevated.
Mildly.
That could mean anything or nothing.
Yeah, I know. I have no reason to think that it's vasculitis, except that it could be. If the blood vessels are inflamed, that's going to look exactly like what we saw in the MRI from Trenton County. The pressure's going to cause neurological symptoms.
You can't diagnose that without a biopsy.
Yes, we can. We treat it. If she gets better, we know we're right.
And if we're wrong?
We learn something else.
The nurse said you're stopping my radiation.
We're just trying some alternative medications. So where's your family from?
Steroids aren't an alternative to radiation.
The tests weren't really conclusive.
We're treating him for vasculitis. It's the inflammation of blood vessels in the brain.
I want you to check the patient's home for contaminants, garbage, medication.
I can't just break into someone's house.
Isn't that how you got into the Felkers' home? I needed somebody around here with street smarts.
So how are you feeling?
Much better, thanks. Are you Dr. House? I thought he was a he.
No. Don't eat too much too fast.
Thank him for me.
Right.
Should I discontinue the treatment, boss?
You got lucky.
I can't see. I can't see.
Your chest will be sore for a while. We needed to shock you to get your heart going.
So what now?
Given the latest symptoms, it's clearly growing deeper into the brainstem. Soon she won't be able to walk. She'll go blind permanently, and then the respiratory center will fail.
How long have we had?
If it's a tumor, we're talking a month or two. If it's infectious, a few weeks. If it's vascular, that'll probably be fastest of all. Maybe a week.
We're going to stop all treatment.
I still think it's a tumor. I think we should go back to the radiation.
She didn't respond to the radiation.
Maybe we didn't see the effect until after we started steroids.
No, it's not a tumor. Steroids did something. I just don't know what.
So we're just gonna do nothing? We're just gonna watch her die?
Yeah, we're going to watch her die. Specifically, we're going to watch how fast she's dying. You just told us. Each diagnosis has its own time frame. When we see how fast it's killing her, we'll know what it is.
And by then, maybe there's nothing we can do about it.
There's gotta be something we can do. Something better than watching her die.
Well, I got nothing.